Welcome to Lesson 1 of our patient orientation. My name is Ava and I'm one of the patient partners on the ReachNet team. I co-developed today's training materials on the research process and the patient role. This lesson will cover the purpose of health research, important topics related to research ethics, and the patient's role throughout the research process. First, we must define what is research. Research is the process of identifying a problem and finding a proven solution to that problem. Specifically, health research creates generalizable knowledge to inform clinical practice, healthcare, and health-related policy. For example, studies can be done to find better ways to prevent, detect, or treat health conditions. There are 4 major categories of health research. In clinical trials, we assign human participants to one or more health-related interventions to evaluate the effects on health outcomes. In behavioral studies, we gain understanding on how people's behavior and choices affect their health. Health services studies explore how the delivery of care impacts health. And in comparative effectiveness research, we compare one approach to managing a disease to the results of another approach. Health research is really important. It informs public policy to support healthy living, recommendations which help individuals change behavior or habits to improve health, improvements in healthcare settings in the doctor's office or hospital, vaccines to prevent disease, diagnostic tests to detect diseases in the early stages, and medicines and procedures to treat disease. There are rules and instructions that protect us from research that is not ethical or safe. Any research involving people must be reviewed, approved, and monitored by an ethics committee that protects the rights and welfare of the participants. These committees are usually called the Institutional Review Board, or IRB. IRBs ensure that there is proper conformed consent. Participants must be clearly told about the purpose, procedures, risks, and benefits in language that is simple, clear, and easy to understand. Researchers must communicate that taking part in research is voluntary and that there is no consequence for saying no. IRBs try to make sure any risks are as small as possible, including protection of privacy. All risks must be monitored and minimized throughout the study. IRBs also look at fairness. There need to be benefits to participants or society from the research. IRBs give special attention to protecting children, prisoners, the elderly, and people with disabilities. Patient-centered outcomes research, or PCOR, especially focuses on respect for communities, cultures, and individuals. PCOR is sensitive to the experience of communities that have suffered discrimination and exploitation in the past. PCOR funders require researchers to behave in trustworthy and respectful ways and to share benefits with all research partners. In conducting health research, scientists follow a systematic process. Historically, we as patients have not been included in this process. Over the past decade, patient engagement has become more valued. As you look at these steps, can you see where patients should be involved? In patient-centered outcomes research, patients inform and affect change at every step of the research process. We'll now go through how patients do this in each of these steps. First, we determine the research question. When patients are involved in defining the research question, it ensures the topic studied is relevant and important to us. For example, we often consider quality of life outcomes in addition to purely medical outcomes. This can happen in a variety of ways. Researchers may form advisory groups around the research topic. They may poll patients to identify what is important or to prioritize a list of topics. They may also conduct focus groups or interviews to gain a better understanding of our perspective. In addition to the research topic, patients and researchers will work together to strengthen the research question. You should ask questions that are specific. Here we see weak questions compared to strong questions. Can test Y be used as a screening for hypertension is a weak question. A better question is, how effective is test Y as a screening for hypertension? What are the appropriate indications for aspirin is a weak question. Instead, we can ask, does aspirin improve certain outcomes for certain patients? Or ask, what types of patients is there strong evidence that aspirin improves certain outcomes? When patients are involved in the proposal writing stage, the researchers benefit from a greater likelihood of funding. Many funders require patient engagement and/or patient partners to be engaged in this step. It also ensures that the guidance provided by us is accurately captured in the project plan. This transparency is important to build trust and to set a solid foundation for the future relationship between researchers and patient partners. We should co-develop any patient engagement strategies and see the final submission. We are often involved in the writing, revisions, and final review of the funding proposal. When patients are involved in developing the design of the research project, it ensures that researchers are sensitive to the experience of participants. We provide guidance to ensure the study methods and materials are clear and respectful to participants. We may select the specific outcomes to be measured and the best way to accurately capture these outcomes. For example, in a study on obesity, how would weight loss be captured? In pounds lost, a decrease in body fat, or waistline circumference? When patients are involved in the recruitment stage, recruitment volume and participant retention are improved. We could be asked to provide feedback on proposed recruitment materials, or a patient work group could develop recruitment strategies and the materials themselves. In any case, patients help answer critical questions, such as, how can we best reach the target population? Is all the important information included, easy to understand, and ethical? What should recruiters say during the initial phone screening interview? And what incentives could maintain participant commitment to the study? Here we have an example of an effective recruitment flyer. This flyer attracts attention. Its colors and design are appealing, and it has positive imagery. It begins with a prompting question and provides overall background and purpose for the study. The flyer deliberately states that there is no cost for participants and that participants will in fact receive beneficial services. Eligibility criteria is also clearly highlighted and is listed above study contact information. When patients are involved in the analysis stage, it impacts how data is interpreted and ensures that the results are an accurate representation of the information collected. This is extremely important when translating study findings into clinical care. This step often has the weakest patient involvement. This can be due to the challenges with the research team identifying that value we add, and highly technical discussions being intimidating for us. For researchers, the dissemination stage of research often means publishing findings in scientific, academic, and professional journals. While this is a necessary step for their careers and the research field, patient-centered outcomes research brings findings directly to the people it is most important to patients and their caregivers. When we are involved in the dissemination stage, the PCOR cornerstone is satisfied. Patients should provide guidance on how to best deliver findings to the appropriate population. The how question takes various forms. How can we present the results in a way that is easily understood? Should we publish results in patient-focused publications, and if so, which ones? Are there social media opportunities or outside partnerships? Could participating health clinics share results throughout their network by newsletters or through their website? Again, dissemination is a critical part of patient-centered outcomes research. In many cases, researchers must have a dissemination plan in their research proposal for funding. We may be asked to guide dissemination strategies before study even begins. This concludes Lesson 1 of the Patient Orientation. Today we've discussed healthcare research and ethics, as well as the patient's role through this process. Now we would like you to test your skills with research literacy. Please complete the vocabulary matching activity. We've included a supplemental presentation titled Research Vocabulary 101. It covers all terms and concepts in the Lesson 1 activity. You're welcome to view that presentation at any time. After completing the vocabulary matching activity, please proceed to Lesson 2 of the Patient Orientation.